Okay, class, we now are looking at how do you determine blood pressure? How do you take your blood pressure? How do you determine it? So that's what this particular video is on, okay? The most direct, exact method of measuring blood pressure, which would be arterial blood pressure, because the blood pressure is in the artery, arterial blood pressure, is to insert an arterial catheter directly into the blood vessel, an arterial line. That line then would get a direct measurement of your blood pressure. See here? There's that cycle, cardiac cycle. So that is the direct method. Now that's an invasive method. Could carry infection, could be bleeding. So for routine blood pressure determination, we wouldn't do that. What would we do for routine blood pressure? Well, you've seen this, what we call a manometer. Now, whether you do it using a stethoscope or you go to CVS pharmacy or Walgreens and put your arm in that sleeve there, this is an indirect method. You're squeezing the blood vessels and getting an interpretation. So it has certain error. Fortunately, not much. But of course, it's nothing like having this. All right. The key to using the sphygmomanometer is to go back to something we have discussed before, and that is laminar and turbulent flow. Now let's say we're dealing with your brachial artery right here, your brachial artery, okay? Brachial artery. Laminar flow, remember, was in layers. Laminar flow is totally quiet. Laminar flow is totally quiet. So when we blow up the cuff, we change laminar flow to turbulent flow. Turbulent flow creates a noise. That noise can be picked up by the stethoscope. And that's what we're doing. We're trying to make the blood flow turbulent temporarily. Now you hear my word, temporarily, because we don't want to, constrict off your arm. Speaking of that, if you get a blood pressure cuff and start trying to take blood pressures, don't do it on someone that has poor circulation, because what you're going to do, you're going to blow it up and say, wait, let me put this here, let me put that. That distal part of the arm is becoming ischemic. I-S-C-H-E-M-I-A. Remember that word, ischemia. Remember that word, ischemia. That word ischemia means decreased blood flow. I-S-C-H-E-M-I-A. Okay. So try it on somebody that's nice, healthy, young, and so then you can kind of play around with it. All right. What happens in the blood pressure determination, let's come over here, is this. You're putting the blood pressure cuff around the arm. Okay. Now that brings up something too. Appropriate size blood pressure cuffs. Let's go down here. The appropriate size blood pressure cuffs, there are several sizes of cuffs. The larger adult cuff, something called the thigh cuff. Okay, the key to it is this. So you have to kind of look at the circumference of the arm. Now most individuals will use just a regular cuff. But research is very clear that measuring blood pressure with a cuff bladder that is the wrong side artificially alters the blood pressure result. Too small of a cuff gives an artificial high reading, and too large of a cuff gives an artificial low reading. So it's important that the person have the appropriate size cuff to use on the particular arm. Okay, so we go back. All right. So what will happen is you will, now here's this right here. Okay. This is one cardiac cycle. What you're essentially doing, and listen well, is you're putting the blood pressure cuff on above the elbow. Then you're blowing the cuff up. As you want to blow the cuff up higher than the systolic blood pressure. Now the systolic blood pressure occurred again at ejection contraction. So I want to go above that. Now, the best way to do that is, that you're sure, is to take the pulse. Because once you blow the blood pressure cuff up and the pulse disappears, there's no pulse, that will say then that you're above here. Now that's the best way. Of course, if you don't think the pressure's too high, you could just blow the cuff up to around 200. Now that's a kind of another way, not the most exact way. And you should be above here. And as if person's blood pressure is above that, you still is going to be above that 200. But hopefully they don't have that kind of hypertension. So then you're above it. Okay. Now there's no flow at all. So there's obviously no sound. See, this stethoscope is distal. The stethoscope is distal to where you did it. So there's no flow. So there's no sound. Then you gradually let the cuff down. As you gradually let the cuff down and open it up, you will start to get a little peep of blood out every time the heart does ejection contraction. If you see, the only time would be when there's a hit to do ejection contraction. So that first sound you would hear would be a real soft sound, but it would be more pulsatile in nature. These sounds, which I'm not going to go into, were elucidated by a guy named Korotkov, Dr. Nikolai Korotkov. And this is what nursing will teach you. They'll talk about the Korotkov sounds. I'm just kind of giving you an idea, but I would like to show you this. Okay, now you let the cuff down slowly, and you're listening, and you'll only hear that sound. Then as the cuff goes down more, it'll open up more. If it opens up more, the sound will get louder, and then more, louder, louder. Okay? Now, once you let the cuff down to where it's below this, no sound. So, the true systolic using this is when do you first hear the peep of sound, then you'll keep hearing sounds. They'll kind of disappear a little bit. And then you'll get to the point you hear absolutely no sound. Because now you're back into what? Laminar flow. So you'll have this and then this. Now, it depends on how good your ears are. I don't know if anybody knows what presbycusia is. That's where the eardrums get stiff as the person gets older. Or it could be other things. You see, this is a high-pitched sound right here. So some individuals with hearing problems may not hear that. It may be too soft, too high-pitched. So they won't hear the sound till it's down here. That means technically the blood pressure that they are saying the person has is not the true blood pressure. It's when they first heard it, which is down here, not up here, because their eardrums could not vibrate fast enough. See, high frequency sounds require fast vibration of the eardrum. The eardrum is more stiff, it's hard to vibrate. So they won't hear the sound until it's down here. Okay? So they may say your blood pressure is 120 over 80, whereas really 155 over 80. Now, then the next situation is, when did it disappear on you? When did it disappear? So you got to go back up. You're going to say, I think it disappeared there. You'll go back up. Oh, now it's there. See, there's only one true systolic, as I mentioned, but a lot of diastolics. What are we interested in when we say your blood pressure is 120 over 80? What's the highest it is and what's the lowest? See, the highest has more to do with how good the heart is. The lowest are how good your blood vessels, how clean they are. Because remember, once the heart is not doing it, is not in the game, then it depends on the blood vessels. So a person with if the person was nervous, real nervous, and they kick in that sympathetic nervous system, when they first get in there, they're all scared of their blood pressure. They may have a slightly elevated systolic. The one that varies the least, listen to me well, the one that varies the least is the diastolic. It has more to do with the blood vessels. That's the one that varies the least. Not to say it doesn't vary, but it varies the least. But the systolic could vary a little bit because of that. So this right here is due to the heart, that's systolic, and this up in here are due to the more of the cleanliness of the blood vessels. Okay? So that kind of gives you an idea. I'm going to try to put a video in. Actually, here is a video that you could look at. I may put another one in the lineup. So that gives you an idea of how to take a blood pressure. Thank you.